Welcome to this webinar on healthcare in France post-Brexit. I'm Andy Bridge from A Place in the Sun, and I'm delighted to be joined by Ellen Pearce Langton, who is the Department for Health and Social Care's Regional Healthcare Advisor based at the British Embassy in Paris. Hello, Ellen.
Hi, Andy. I'm happy to be here, thanks.
Good to have you along. Thanks for joining us. So today we aim to dispel some myths that are built up about buying a property and moving to the EU post-Brexit. Yes, we know it has become more complicated, but there is still a clear route to residency, which varies depending on the country you wish to move to. Today's focus is on relocating to France, and a key question we're asked time and again relates to accessing local healthcare, and Ellen is well placed to cover all this for us. So here we go with a series of statements that you can decide whether they're true or false before hearing the answer from Ellen. When visiting France on holiday, you can still use your EHIC or replacement GHIC card if you need to visit the doctor. True or false?
Yes,
Ellen.
that's actually true. So for short stays in France, you can continue to use your current EHIC as long as this hasn't reached its expiry date yet. Afterwards, you can then apply for a new global health insurance card or GHIC, which functions in the exact same way as the current EHIC. So that means that you will be covered for what's called necessary care for short stays in all EU member states. Necessary care is decided upon by the medical practitioner at the time of treatment, but it's broadly described as treatment which is necessary for you to fulfill your short stay in that particular EU member state. However, necessary care doesn't cover everything, and so your EHIC or your GHIC does not cover everything, such as, for example, medical repatriation, should you need to be taken back to the UK after having an accident or something like that. So that wouldn't be covered by your EHIC or your GHIC. So you must make sure to take out comprehensive travel insurance, including healthcare, before you travel. Just another note, if you are not visiting France and you decide to reside in France, you should not use your EHIC or your GHIC to access healthcare in France. You should make the appropriate steps to sign up correctly for healthcare in France.
So the provision of healthcare for visitors via EHIC or the replacement GHIC card, in effect, there's been no impact from Brexit on that. It's the same situation that was in place before.
Exactly. And if you do have a current EHIC card that is in date, you can continue to use it. You will only need to request a GHIC once your current EHIC has expired, but the provision of care is exactly the same.
That'll be welcome news to holidaymakers and holiday homeowners who are visiting their place in France. A UK pensioner retiring to live in France post-Brexit can get free healthcare. True or false?
Okay, so that is actually true. If you are a UK state pensioner, you can continue to request a form which is called an S1 form. Now that's just a kind of fancy term for a piece of paper which allows the UK to fund your healthcare in France. So this form, the S1 form, continues under the Trade and Cooperation Agreement, which was signed just before Christmas. So this means that eligible pensioners and their family members will continue to have their healthcare costs covered by the UK should they move to the EU. This particular S1 form, you can register it with one of the local French state health reimbursement offices. There are 140 of them throughout France. And these are called Caisse Primaire d'Assurance Maladie. You go to this particular office, you take your S1 and some other documents, and you can register it with them, and they will then allow you to access French state healthcare and it be funded by the UK. So this will actually entitle you to the same coverage as a French state pensioner. So some really important information. French state healthcare actually does not function like the NHS. And so sometimes the state will only cover a certain portion of your healthcare, on average 70%. So the S1 form will cover you for the portion that the state would cover. So that on average 70%, depending on the treatment and depending on the medical practitioner. For the remaining percentage, this would have to be paid either by yourself or by something which we call top-up insurance, or a mutuelle in French. These are normally inexpensive and they will cover you for that remainder, and it gives you peace of mind. But just to explain also that the French system is quite flexible. If, for example, you have a chronic illness, then quite often this reimbursement rate goes from 70% on average up to 100%. But this you would have to see with your general practitioner in France at the time and run this past your caisse primaire d'assurance maladie to make sure that this corresponds to their list of chronic illnesses to be covered at 100%. Remember, if you are moving, I just reiterating it one more time, if you are moving to France and you are going to reside there, you should not use your EHIC or your GHIC. As an S1 holder in France, as a UK state pensioner in France, you will be entitled for a GHIC to use in other EU member states if you're travelling for short stays and for necessary care, but you will not be able to use this to access French healthcare in France. I hope that's clear.
That is clear, but the fantastic news for British pensioners wanting to relocate to France then is that there is a state provision that matches the same rights as a French citizen.
That's correct.
And just to clarify, when you said the top-up insurance, I think you said it was inexpensive?
It is inexpensive, yes. It's not like full private health insurance, and most French citizens have a mutuelle to cover what we call the co-payment. So that's the bit that's left over after what the state covers.
Registering with the French healthcare system can take up to 6 months. True or false? Yes,
that's correct. So it can take a little bit of time to register for French healthcare. If you are moving to France and you are not working, so you're maybe an early retiree, you have to have been in France for 3 months to be able to actually start your request for French healthcare. So already you have a little 3-month wait, and in that 3-month period, you should make sure that you have private health insurance. After that, you should really apply as quickly as possible because it can be a long process. When you make your first application to receiving what we call a temporary social security number, that can take around 3 months. And this number allows you to have medical reimbursements the paper way, I like to call it. So you receive your invoice from the doctor and what we call a little brown form, which you send off to your local reimbursement office. I talked about that earlier, and they will then refund you in your bank account. After another 3 to 4 months, this number becomes permanent, and at that point you can ask for a card which is called a carte vitale. It's a medical reimbursement card, and it just stops you from going through that long paper process. So your doctor, when you go to visit that doctor, they will ask you for your carte vitale, they put that in their machine, and then your local reimbursement office gets a message to say that Ellen, for example, has paid 25 euros. We need to reimburse 70% of that onto her bank account. So it just kind of cuts out that paper process. But from applying at the very beginning to then receiving your carte vitale can take 6 months. So be patient and just make sure that you're ready before you move, that you've done your research and that you get all of your documents ready so that you can really speed up that process.
Fantastic. So there's a 3-month period at the start where you definitely advisable to take out private healthcare. And then from the end of that period, potentially for another 6 months, there's a period where it could be more administration in terms of paying and then getting the refund. And then hopefully after that period, you could consider yourself registered if that's gone smoothly.
That's correct. That's correct. And I just wanted to actually add something about that. Your medical reimbursements are kind of backdated, so to speak, to when your local reimbursement office receives your application. So let's say in those 3 months before you get your temporary social security number to get reimbursements the paper way, you will then actually, if whatever you've paid in those 3 months without that number, you can actually get reimbursed. So those are backdated.
That's really clear. Thank you. If you retire to France before pensionable age, you need private healthcare. True or false?
Sorry,
All right.
treading on your toes a little there. That's okay, so that's true and false. So I'll start with the false, and we've covered this a little in my previous answer. So if you move to France as an early retiree, so somebody, as they say, without professional employment, you can access the French healthcare system based on residency. So you'll need the correct residency documents, known as a titre de séjour, and hopefully you will have acquired that before, whilst in your first month of moving. And also you'll need to have waited at least 3 months to be able to make your request for healthcare. So after that point, you should be able to access state healthcare in France. There is that long process, that long administrative process that I talked about earlier, but normally you should be able to access state healthcare in France, and this is evaluated on a case-by-case basis by your local reimbursement office, so the Caisse Primaire d'Assurance Maladie, known as a CPAM office. However, for those first 3 months, you must take out private health insurance to make sure that you're covered for any nasty surprises, shall we say.
Again, very good news, because you can move to France, not be of pensionable age, not access via the S1, but apply via a residency after the 3-month period. So that must be welcome news to our audience.
That's correct.
If you move to France to work, obviously with the appropriate working visa in place, you can pay into and benefit from the French National Health Service. True or false, Ellen?
That's completely true, and some kind of good news for workers. Unlike for early retirees, you can actually make your healthcare application as soon as you start working. So that's a lot quicker. And you'll be making social security contributions as soon as you start work in France, so you can access the state healthcare system. It's the same as for early retirees and S1 holders, so UK state pensioners. The French state healthcare system only covers a certain portion of your healthcare, and so you will need to have a mutuelle or to pay the extra % on top. Normally your employer will help you with a choice of mutuelle in this case. If you are self-employed, however, you will need to take appropriate steps to make sure that you're registered for social security contributions in France. If you're in a cross-border situation, so that means if you're crossing the border between France and the UK at least once a week to be able to go to work, then you may be entitled to an S1 as a frontier or a cross-border worker. In this case, to find out if you are eligible, you should contact HMRC.
After moving to France, you will have free access to the NHS when visiting the UK. Is this true or false, Ellen?
I know this question is very important to many of us, but unfortunately it is false. The NHS is a residency-based system, and so you shouldn't expect to retain the same rights as you would have had if you were living in the UK. If you're working in France, or if you're an early retiree signed up for French state healthcare, you may be entitled to a French European health insurance card, known as a Carte Européenne d'Assurance Maladie, a CEAM card, to cover you for necessary care when you're visiting the UK. So the definition of necessary care remains the same, whether that's in France, another EU member state, or the UK. So that is determined by the medical practitioner at the time of care, and it's broadly described yet again as care which allows you to fulfill your short stay in that member state or in the UK. So if you want to find out how you're covered for care going back to the UK and accessing the NHS, we would recommend that you contact the NHS Overseas Services or look on the NHS pages for planning your healthcare abroad. And
if I was a retiree to France, accessing French healthcare system, would I be able to get an EHIC card or replacement GHIC and use that when I go back to visit the UK?
Now, that would actually depend on your situation. If you're an early retiree, then you may be entitled to a French European health insurance card for care in the UK for necessary care. If you're an S1 holder who arrived in France before the end of the transition period, you will be able to use your special UK EHIC card known as the Citizens' Rights EHIC card to access NHS, to access the NHS as usual in England. You can also use a copy of your S1 form in that case. However, if you're a S1 holder who arrived in France after the transition period, then the arrangements are different, and we recommend that you check this before travelling.
As a UK citizen, you move to France with your EU, for example, a French partner, you are entitled to free healthcare. True or false, Ellen?
Now, that's actually false, but I don't want it to sound all doom and gloom, because it's actually good news in the French system. So the French system is actually defined as a universal protection system. That's what they call it, the Protection Universelle Maladie. And this system allows people to actually access healthcare on the basis of stable and regular residency in France without needing to be dependent on somebody who is a French national or an EU national. So if you're over the age of 16 and live in France in a stable and regular manner, then you are entitled to state healthcare in France. So as I explained for early retirees, it's the same system. You have to apply after 3 months in France. You have to have correct residency documents, so a titre de séjour. And you have to obviously file these with your local Caisse Primaire d'Assurance Maladie, so the local reimbursement office, and they will assess your case on a case-by-case basis.
Thank you, Ellen. That's been really helpful. These are the sorts of questions we're receiving all the time from our audience. There's more information on this and on relocating to other countries at placeinthesun.com. Check out the new relocation area. We have webinars and healthcare advice on moving to Portugal and to Spain as well. Thank you again, Ellen. It's goodbye from me, and it's goodbye from Ellen.
Bye, everyone. Thanks, Andy.